Let's talk about neurofibromatosis. Neurofibromatosis. In this formation of neurofibroma. Hope you're aware with the term OMA, which is tumor growth. Now, neurofibromatosis, also called as NF, it is an autosomal dominant inherited disease, right? And there are again two main types, NF1 and NF2. NF1 being much more common, and it is roughly around 1 in 3000. Good. All these neurofibromatosis primarily affect CNS and PNS, where the nervous system is present. Now, let's talk about the gene. So the gene involved, remembering it is very easy. So for NF1 and for NF2. So NF1 is NF1 gene. For NF2 it is NF2 gene. And this NF1 gene is found in chromosome 1. Turn this 1, it will look like a 7. So chromosome number 17. For this 2, take here 2 and change it over here 2. So chromosome number 22. Pretty much easy, right? So this is the most important types. So we are done with chromosomes and gene. And again, the patient can have an acquired gene or genetic gene, as I've already discussed how the inherited patterns occur in an individual. Now let's talk about the clinical case. Clinical features. So for clinical features, there will be tumor, right? So the tumor can be in peripheral nerves. It can be found as gliomas of optic nerve. Now the same presentation can be seen as pigmented nodules. Now from where this pigments comes in iris, pigmented nodules of iris. Now this is also called as Lish nodules. So if you will have an eye, and this is your iris, right? This is your iris. Now there can be some hyperpigmented nodules on it, okay, and these are called as Lish nodules. Let's say this is your eye. Okay, now next is the same nodules, pigmented nodules. So pigmented, right? How these pigments come? Pigments come from melanocyte. So the changes in nervous system will cause them to stimulate more than usual and to deposit more and more melanin into the cells, which gives us the pigmentation and the color. So for the skin we will have cutaneous hyperpigmentation of macules. This is classically known as cafeola spots. Also, they can be seen as freckles. Now, very important things to remember. Now, for NF2, okay, so these clinical features will be more and more common in both the cases. However, this is much more common in NF1. For NF2, one classical feature is that most commonly bilateral schwannomas that is of cranial nerve number 8, vestibulocochlear nerve, on either side will be seen. However, when I mentioned bilateral, which means that there will be unilateral as well. However, the unilateral one is not an autosomal one. That is the much more of acquired one. So bilateral is a classical feature. Bilateral is a classical feature of autosomal dominant neurofibroma type 2. That is bilateral schwannoma. So whenever in CT we can see the schwannomas, we can suspect NF type 2. Now, they can be also multiple meningiomas. Don't worry, I'll talk about all the different types of CNS tumors in some other lectures. Okay, for now just remember the names. Okay, meningioma is a tumor of meninges. Okay, now let's classify again. So the classification was somewhat like this. So there were PNS involvement, there was CNS involvement. Okay, in peripheral nervous system there was again neurofibroma, which is much more common present. However, they will be present in CNS also, but in PNS it is much more common. Now, and we just said that cafeola spots and freckling will be positive in this case. These were actually the hyperpigmentation of skin presented as macule. For CNS, they were primarily as of two main types, NF1, NF2. NF1 will be seen as astrocytomas, and NF type 2 will be seen as bilateral schwannomas, plus meningiomas can be seen as well. I guess I have a picture of cafeola. Okay, so these are the macules. Hyperpigmented macules, which can be seen. These were actually your cafeola spots. Fine. Before that, let's have the last slide, probably the last one. Now, the manifestation will be due to compression of nerve tract. Okay, so there can be again blindness, deafness, altered sensorium, and so blindness, if the optical nerve involvement, because of optical nerve involved, CN2, right? Then there can be deafness in case of CN8 involvement. Then there can be increased intracranial pressure if there are so many tumors. And then there can be also seizures, headache, psychotic abnormalities. Now, how to diagnose it? Diagnosing is again kind of easy. There will be positive family history. There can be positive clinical features, which we already discussed. Then there will be, we can also do some imaging of CT and an MRI to check for the CNS tumors alongside of the physical clinical features, plus physical features must be present. Okay, let's see the next picture. So in this first picture we can see that also before that okay, so the first picture is a severe case of it. However, in this case it's a solitary one. So in order to understand, let's say we have a skin and then there are layers of skin. In the first slide I just said that there's the formation of nodules. So a nodule is something which is deeper inside, and at the same time it is also a bump outside. So this is up and this is inside the skin. Okay, we can see this part as visible. Okay, however, this upper above part can increase in size so much. Not only this, but also like this, it can become even bigger, all this part. This is seen in much more severe cases in this case. Okay, all these bumps and all these nodules, multiple nodules all over the skin, is somewhat like this. However, in this case, in the solitary one, again there are layers of skin. Okay, let's say this one, and the tumor has not protruded much outside, but it is toward the inside, as in this case. So in order to feel it, we have to apply pressure on both the sides and from all the sides to check how much the margin of the tumor is. Okay, to check for extensions. However, these are again non-malignant tumors. However, they can affect the day-to-day life. So how we treat it? Let's plan a treatment. So treatment, yeah, we cannot plan. Okay, so treatment is none. Patient will be like this forever. However, cosmetically we can excise the tumors and nodules. Okay, one more point. All these nodules are actually arise from the nerve bundles. If this is a nerve bundle, it arises from the nerve bundle. Okay, good. Also, we can go about the radiation treatment. And one more point, we can check for the pathological features. So radiation of tumors and so on and so. Also for symptomatic management can be done. Management for increased ICP, seizures, SSRIs and antidepressants, etc. Now, very important feature I just forgot to tell you. Now, what actually happened in this case? Within this cell, nervous system cell, the nucleus become a spindle shaped. And this feature, spindle shaped nucleus. Okay, prominent feature, prominent and main feature. So let's see an image of this. Hope you can appreciate all the spindle shaped nucleus. So 1, 2, 3, all of them, almost all of them have this feature. See? So this is a classical feature of neurofibroma. Okay, and that's all. Thank you for watching.